Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you once again for having me on this program.
Yes, sir. I know it's a busy day for you, so I'm just going to ask you a few, to get it out of the way. Let's talk about the COVID. We're talking COVID curve, and let's speak about the legislation, because you still have a lot of people not adhering, and the people that should be adhering to it. And I specifically want to ask you about house parties.
Well, I think the order is extremely clear. The order prohibits having such parties, and also bars are not permitted to be open. I know a lot of people have been lobbying for us to open bars, but this is prohibited by the order that was issued. So I hope people can abide by the law, because if you don't, you would suffer the consequences.
All right. When we spoke last week, the initiative with the GTA had started. How is that going?
I think that's going very well. GTA has been working with the restaurant owners. They make an assessment of the capacity of the restaurant, and when they complete that exercise, they then would be able to give approval or don't give approval. Once you have all the things in place, there's a checklist that they're using, and once you have all the different things on the checklist in place, they'll give you approval. And they also put a sign on the restaurant to indicate to persons what is the capacity of the restaurant. So in case anybody turn up and if the restaurant can only accommodate 20 persons and there is 40 persons in there, then that's a breach of the agreement that we have with the particular restaurant. And from time to time, people would be randomly checking to ensure that there is compliance. And if people are breaching it, well, then we'll have to resort to closing the facility down. Because all these things are given with the understanding and trust that the owners would be doing the right thing. If they don't comply, then it would leave us with very little alternatives. So we hope that people can understand what we are trying to achieve here is a balance, but you can't do that to the detriment of the public's health. And we really believe that we need that type of collaboration, and if everybody works together, I think we can do this safely.
All right. Two related to the same thing. We spoke last year about large gatherings, basically for like sporting events and so on. Haven't really heard of much happening in that regard, but is that still?
Those guidelines are still pretty much in place. From time to time, we do get requests from various sporting organizations for specific requests, and we consider them on a case-by-case basis. But anything that would bring large groups of people together, we have prohibited that, because, as you would know, when people gather in those large numbers, most times people are not wearing their masks, they're not complying, they're in close proximity of each other. And because we don't know who's carrying the virus and who's not, if you're in those conditions, the chances are there would be spread. And therefore, to prevent transmission, we believe that we need to minimize these types of activities.
All right. I know initially when COVID curve had started that the emphasis was on education, and I know that now many persons, I don't know the exact number, that have gone before the court for basically not adhering to the regulations. Could you tell us a little bit about it?
Well, I don't have an exact number of how many people might have gone before the courts, but certainly the police have been taking people for breach of these orders, and that would continue. I guess people need to understand that, this is a serious thing. And if you don't wear your mask, if you're not complying with the orders, then it's going to create difficulty for everyone. So again, while our emphasis is really on education, we know a lot of people now know much more about the virus than they did maybe a couple months ago. and that's a good thing. But what you need to now do is the knowledge that you have gained over this period of time, you need to practice it. So most people in Guyana now know that you need to wear a mask. But how they're wearing the mask, that's a problem. Because if you wear the mask under your chin, you wear the mask not covering your mouth or nose, then you're not preventing spread. And lots of time you would see people not complying with the proper wearing of masks. And we need to emphasize that. I know that a lot of people are fatigued, that, wearing masks and having to sanitize your hands often and keeping distance, and so these are not natural things for people to be doing. But the circumstances are really unusual circumstances, and therefore we really need people to comply if we are going to reduce the spread.
All right. Before I touch on the Presidential Commission on the Prevention of and Control of Non-communicable diseases, I wanted to ask you about the field hospital. I know you spoke on it yesterday, and the importance of us having, or the impact rather, that is going to bring to the country, and more so, initially it was slated for Region 3, but I just want to maybe speak to that a little bit so that persons don't think that a particular service is being withheld from the other region.
No, a field hospital is what it is. It's a field hospital. It can be set up in any area because that's how it's built to be established, right? You can put it in any region. What we have considered is not just putting down the facility. I guess that would be the easiest thing to do. But it's how you will operate the facility. And when we had some more discussions, the challenge would be if you're operating this facility 24 hours a day, you will have to get a shift system, you have to get enough staff and so forth, and that can prove challenging. So one of the considerations that we've made, we already have a lot of staff located at the Ocean View facility, and therefore we thought that it would be not a bad idea to add some more capacity in that compound. And we'll have all the technical people, the medical people and so forth right there who can easily assist with running the facility. So that's the paramount consideration that we've used. And the facility, the impact of the facility, it really has additional beds. So if we need to hospitalize more people, then we'll be able to do that. As I said before, it has an additional 60 beds, and that would complement what we already have available to us. So we now have extra, well, I wouldn't say extra capacity, but we now have capacity for hospitalization, and in particular, we have additional capacity in our ICU. So these are good things because we don't know how many more people can get infected, and if people don't comply with the basic prevention methods, then we are going to see more people getting sick. It's not something that we desire, but we have to face reality as well. And if people are not going to comply, we are going to see more people getting sick.
Okay, sir. As we speak now on the Presidential Commission, basically we want to ask you, for the benefit of the public, can you explain what are the NDCs and what are some of the risk factors associated with those, of course, linked to COVID-19?
Well, the commission is not a new commission. It has been in existence for some time now, but the work of the commission had varied over time. So what we are trying to do here, looking at chronic non-communicable diseases, I guess the long name spell it out. These are diseases that are not transmitted from one person to another, and they take a long time to develop, so hence the word chronic. We know some of them because we know people who are suffering with them. Things like high blood pressure or hypertension, problems with heart, so you have cardiovascular diseases. We have diabetes, which is part of a larger group of diseases called the endocrine diseases. We have cancers. We have people who would have chronic respiratory diseases. We have people with chronic kidney diseases. So these are major blocks of disease that we can, in many cases, prevent from happening. But to prevent them, one would have to start changing their lifestyle. Most people now, because of the comfort of having transportation and so forth, they're not exercising very much. So exercise, people need to get adequate amounts of exercise. People need to eat properly. A lot of people might eat plenty, but that does not mean that it's nutritious and it's the right thing to eat. So you need to eat properly. And we've seen bad eating habits, so that's something that we have to correct. And in addition to all of this, we know the role of increased salt intake can have on disease conditions such as hypertension and so forth, and that's something that we want to reduce. We know the role of trans fats. These are things especially with fast foods, and we need to reduce that because trans fat can contribute to some of the risk factors that ultimately lead to cardiovascular diseases or heart diseases. So there are a multitude of things that we want to do, and the Commission is going to look at these things and address them. For me, I think we need to use the power of the Commission to have a broader reach to the organizations that they represent and ultimately to the various communities. And I think if we have a larger conversation on how to stay healthy and the things that we can do to prevent these disease conditions, then we should be having that conversation. And hopefully that the Commission on Non-communicable diseases would be able to do that. I have outlined to them in my presentation that I would like them to look at a number of things, which include those cardiovascular diseases, but I also would like them to develop some specialized plan on diabetes, because we have too many persons who are affected by diabetes, and in many cases they're not taking the right measures to control their blood sugar. With better management, with better access to various types of care, we can make a bigger impact on how we manage diabetes, and that's something that we have to start looking at. We have some ideas that we want to implement over the next couple of years, and we'll be working on those as well. And we want to build partnerships with other NGOs and other organizations who would have an interest in this area. One of the best ways that we can address the issues relating to diabetes would have to be what diabetics eat, how they eat, and in a lot of cases they don't have access to nutrition counseling. So we want to change that, and over time we're going to recruit personnel who can be able to offer this type of advice and so forth. So diabetes certainly would be one of the focus that we'll have. And in terms of the cancers, we want to look at the big ones, because among women, breast cancer has been the number one killer, followed by cervical cancer. And in men, prostate cancer has been the main cause of death among men. So we think we can help to reduce this if we have a more comprehensive program to be able to screen and identify early. And if we are able to put such a program in place, it means that we'll be able to reduce premature deaths. With cervical cancer, it's a cancer that we can eradicate because that is caused by a virus, the human papilloma virus, and therefore if we use immunization using HPV vaccines, we can eliminate this. So this is something that we'll have to look at because our uptake with HPV has been extremely low. But here it is that because people are not taking the vaccines or the vaccines were not available to them, that you're ending up with, when you become older, that you're more at risk for cervical cancer. So if we give the vaccines earlier, then you're protected. You wouldn't be able to develop cervical cancer. So we want to offer that protection to women, and hopefully we can put more emphasis on this in the years to come. So there's a lot of plans that we have for the Commission. And of course, within the ministry itself, this is going to become a big focus because we know from our stats that chronic non-communicable diseases now contribute in a major way to our morbidity profile and our mortality profile. And if we can have an impact on this, we can reduce a lot of premature deaths.
Two things you touched on that I wanted to follow up. The first being, when we had spoken previously, you had indicated, not in these words, but basically saying that there is not a particular age group. We know that the older folks tend to have some of these same complaints, non-communicable, but it's not restricted to them. We have a lot of younger persons when we talk about diabetes and so on as well. And given that we're in the pandemic especially, they need to be more aware and concerned with what, how they basically deal with these health concerns.
Yeah, with chronic non-communicable diseases, we have seen that persons at a younger age can get them. So we have seen people getting heart problems in their 40s. And that, the reason being, there can be multiple reasons. So these are some of the things that we have to study. And we have to look at our local stats and see what is happening here and then devise programs of how we can address that. But cardiovascular diseases in younger people is just one example. And we can look at the other chronic non-communicable diseases and try to get more information and then devise programs of how to address that. But the other thing that we have to look at in the midst of this pandemic is that there are 170 persons that have died so far in the pandemic. A lot of them were older people, and a lot of them had comorbidities. And these comorbidities include persons, majority of the persons would have had a chronic non-communicable disease. And so during this pandemic, it is especially important that people control their chronic non-communicable disease. So if you're diabetic, you have to get your diabetes under control. If you're hypertensive, you got to have your hypertension under control and so forth, because ultimately, if it's out of control, it is putting you at extra risk if you then get infected with SARS-CoV-2. So it is important that people manage themselves well, and once they do that, they can reduce their risk if they get COVID. So this is another dimension that I don't think we have spoken very often about, but it's something that people need to pay attention to. So those persons who have comorbidities, whether you're a diabetic, whether you're hypertensive, whether you have cardiac problems, kidney problems, chronic respiratory problems, all of these conditions can ultimately contribute to you having comorbidities and putting you more at risk for COVID-19.
Yes, sir. My final question to you, as you spoke about nutrition counseling just now, sometimes I get my wires crossed and I forget where I am, but I am not sure if we have it in Ghana. Legislation, I know we have legislation that deals with basically food preparation and covers everything basically for restaurants and food handling and all of that. But do we have any particular legislation to deal with the nutritional aspect in the sense of fast food restaurants? And if we don't, is that something that you may?
We gotta educate the public on what is nutritious. I think a lot of people have the misconception that sometimes you go and you have fast food and that's good. Occasionally, that's not a bad thing to have, but we have to emphasize the importance of having fruits and vegetables and things like that in your diet, because that's an important part of your diet. So, teaching people how to eat and what to eat is an important part of nutrition now. And I guess we have lots of work to do in this area. We have moved from a diet in the past where we were eating more fish and vegetables and so forth, which was a really good and healthy diet. And we have moved away from that to one where we are now eating things that can put us at risk for a number of disease states. So it's an education process, and hopefully we can get people having understand the risk and the benefits of changing their diet, that we'll get them to adopt this change in diet and lifestyle.
Okay. All right, understand. I see that we'll be continuing this particular discussion for a long time. But thank you so much for speaking with us today, and we hope you have a good day. Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy. Remember to follow our social media platforms for more information as well. Thank you.